Come on into my office, Richard.
Thank you.
My name's Ryan.
Ryan Richard, please read it.
So how are you doing today?
Doing alright.
Cool. And we're here today for a drug and alcohol assessment. Has anybody explained to you what that is?
Yeah. You know what's up.
Alright, so you have a pretty good idea why you're here today. I'm just going to ask you a bunch of questions. Some of them might be a little bit uncomfortable, but all of this is for your treatment. It is all confidential unless you disclose something likely to harm somebody, like you're going to hurt yourself or somebody else. Then I'm legally obligated to disclose that. But other than that, this is protected healthcare information that's confidential. I'll probably remind you of that a few times if we come on something that you feel, or I feel like I need to mention that. I'll mention it's confidential.
Okay.
So let's see. Let's get just some easy stuff like your full name.
Richard.
Okay.
J.
Okay.
Morse. M-O-R-S-E.
All right. You know what day it is today?
Yeah. Today's Tuesday, January 27th.
What year?
2015.
Cool. How old are you?
43.
Okay. And I think I already got your date of birth here. Do you know where you're at right now?
Yeah, I'm at the clinic getting an assessment for my alcohol use.
All right, cool. Morning, night, middle of the day?
It's evening.
It's evening? All right, cool. So what brings you here today? Why today, of all times, to come in here and talk to me about getting some help?
Because I just have a major alcohol problem, and I'm about to go to prison. And they wanted me to do an assessment.
Okay. Have you been in jail or prison or anything the last 30 days?
No.
No? Okay, so you've been out. So how long have you been drinking? When did you start drinking?
I was about 15.
Okay. So between you being 15 years old and 43 years old now, why are you coming in for treatment today? Why are you coming in to see me?
Because I'm just sick of lying. I'm sick of the intoxication.
And it sounds like you're facing some time. What are you facing time for?
I'm a pilot, and there was a plane crash, and some people were killed.
Okay.
And they concluded that the crash was because of a mechanical error, but I was drinking also.
Okay.
So I'm liable for my part in that.
How long ago was that? Did that happen?
6 months ago.
6 months ago? You drank since then?
Yeah. I didn't want to. I don't know why I did. I just did.
So it sounds like a pretty major life event, and at that point it sounded like you wanted to be done with it, you wanted to quit, but you couldn't quit.
Right.
All right. So let's say the last 30 days, how much you been drinking?
In excess, probably, 12-pack of beer, half a bottle,
How often?
probably 3 or 4 times a week.
Okay. Like half a bottle, like half a fifth, half a gallon?
Half a fifth.
Of what?
It's whiskey.
Isn't that like half a fifth of whiskey?
Yeah.
When's the last time you drank?
Yesterday.
How are you feeling right now?
All right.
How much you drank yesterday?
About a 12-pack of beer.
Okay. Like last night, or?
Yesterday, yeah.
So yesterday you drank about a 12 pack.
Yeah.
Haven't drank today.
No,
Okay.
I didn't really get drunk either.
Okay. Have you ever stopped before?
I've tried. Yeah, I have. I've maybe made it a week.
Okay. Withdrawals or anything in that week? Shaking, tremors, seizures?
I don't think so.
Okay. So no, you haven't experienced withdrawals in the past?
No,
Okay.
not that I know of.
Alright. So not feeling intoxicated right now, but you're not feeling like you're crashing or anything right now.
Right.
You've quit before for a week and not really had any major effects. Were you drinking this much, like 12 beers, half a fifth, and stopped
Yeah,
for a week? And,
even
okay.
more.
Even more than that in the
Yeah.
past?
Yeah.
Okay. I'm just going to go through kind of like a laundry list of different substances and just get like a yes, no from you. And if it's yes, we'll just kind of do an inventory of use. A lot of this stuff is illegal. I understand you're facing some time, it sounds like, but this is for your treatment. It's not going to be shared with anybody unless it's subpoenaed or something, and it's part of your health record, so it's confidential.
Okay.
So any tobacco use?
Yeah, I smoke cigarettes, about a pack a day.
Okay. Last time you used it?
Right before I came in.
Okay. Cocaine?
Yeah.
Okay. When's the last time you used?
This morning.
Okay. How much?
A little tiny bit.
Alright.
Just a little sniff
Okay.
to get me but I'm not intoxicated. Today it's the evening time. I was early this morning.
Let me go back a little. How old were you when you started smoking?
Probably about 20.
Okay. How about cocaine? How old were you when you started that?
Probably about 25.
How much do you normally use and how often?
Cocaine.
Yeah.
It's like a line when I'm really drunk in the mornings to get me going.
All right. How much is a line for you?
Quarter gram.
Okay. And that's every day or?
3 or 4 times a week.
Okay. Have you ever experienced any withdrawals or anything from the cocaine?
No, I don't think so.
Experienced cravings?
Yeah.
How about for the alcohol?
Yeah.
Okay. How about heroin?
No, never done heroin.
Benzodiazepines like Xanax or Valium?
No.
Okay. Marijuana?
Yeah.
Okay. Tell me about that a little bit. When did you start using marijuana?
When I was a teenager, I just tried it.
Okay.
Led to other drugs.
All right.
I don't really buy it or need it. I keep some at the farmhouse. I don't seek it or want it.
All right.
You
Well,
know, I'll use it if it's around, if it's party time, but that's
Yeah.
about it.
when's the last time you smoked pot? Or
It's been weeks.
ate pot or whatever? Yeah, it's been weeks.
Yeah.
So. Is it a regular thing? Or,
No,
no?
it's not.
It's like once a month or?
Yeah,
Okay. How much do you smoke? If you're smoking?
just a joint.
Ever feel any withdrawals, cravings for that?
No.
Okay. I got a list of a bunch of other stuff. It would probably be quicker if you just let me know. Is this pretty much it, or is there other stuff? Sleeping pills, mushrooms, acid, sniffing glue, cough syrup, anything like that?
No, none of that stuff.
Meth, ecstasy,
No,
spice,
no.
diet pills, bodybuilding formulas, supplements, or steroids, or nothing like that. Bath salts, or
No, nothing like that.
Okay.
Never.
So as far as substance use is pretty much alcohol. You smoke cigarettes, cocaine, and marijuana, but kind of rarely, and maybe just when it comes up. You got some at the farmhouse.
Yeah.
Anything you'd like to add to that?
No.
All right. So you say you really not experiencing like withdrawals. It sounded like you drank yesterday. You had a little sniff of Coke this morning. Are you experiencing any other things, like is your stomach okay?
Yeah, it's okay.
And it seems like you know where you're at and what you're doing. So,
Yeah.
all right. Cool. Not seeing things that other people can't see or anything like that.
No.
Hallucinations, nothing like that.
No.
All right. So, what do you consider healthy as far as a healthy person medically?
Not taking prescribed medications, not being sick, or not being able to function, what I consider healthy,
All right.
being able to hold a job, be a dad,
Alright.
keep all your obligations up to date on
Alright.
time.
Cool. Do you consider yourself healthy?
Yeah.
All right. When's the last time you saw your doctor?
It's been a long time, years. Maybe 2 years.
Do you have a regular doctor?
Yeah,
Okay.
Dr. Hogan.
Okay. And I think we got his phone number on file.
Right.
Are you allergic to any medications?
No, not that I know of.
Are you on any medications?
No.
Been drinking pretty heavy since you're 15. You ever had liver, kidney, anything like that? Difficulties, nothing
No.
like that? Surgeries, anything like that?
No, nothing.
Okay. Anything where you've been prescribed pain pills for anything, or?
Maybe the dentist.
Okay.
Dentist work.
You just using those as prescribed?
Yeah. Yeah.
Yeah. You sound a little
Yeah.
hesitant, but
Well, a couple times I probably took a couple more than I was supposed to, but you know, my teeth.
okay.
I was after getting teeth pulled and bridges put in. And
Okay. All right. Do you have any other allergies besides pills, stuff like
No.
that? No. Okay.
no.
So no ongoing medical or physical problems.
No.
Any disabilities that might interfere with treatment?
Just alcoholism.
Okay.
Is that a disability? That's not really a disability.
I don't know that that's a disability. I mean,
Yeah,
that's what
no
that's what you're here to
disability.
be treated for. So maybe a disability might be a learning disability,
No.
or maybe need adaptive stuff, like if you're blind or need a wheelchair or something like that,
Okay, yeah.
or
No.
deaf or something like that.
No, nothing like that.
Okay. Just lots of things that you could be considered disabled for, but it sounds like you're here for the alcoholism, and yeah, we're here to treat that, so that would be considered here. How would you rate your ability to remember things? Poor, average, or good?
Good.
All right. What's the highest level of school that you've achieved?
Bachelor's degree
Okay.
and flight school.
What'd you get your degree in?
Business administration.
Okay. Flight school.
Airline flight. Yeah, it's all.
Were you in the military? A lot of airline pilots are in the military.
Yeah. I was.
What branch are you in?
82nd Airborne Air Force.
Air Force.
Yeah.
Cool. So you're trained as a pilot.
Yeah.
How would you say that you handle anger?
By drinking.
Yeah.
Yeah, I handle anger pretty good. I've never been arrested for any domestic violence or violent acts or fighting or anything like that. drunk when I got mad.
Yeah.
I think sober I handle it just fine.
When you maybe think of your family history or stuff like that, what would it look like if somebody was angry?
Just yelling and screaming.
Yelling and screaming and
Trouble.
stuff like that.
Stuff, yeah.
Is that something you experienced?
Yeah.
Okay.
And some yelling and screaming and throwing stuff. I've never hit anybody though.
So you've done some yelling and screaming and,
Yeah.
and throwing stuff.
Mhm.
Any kind of family history? You see that growing up at all or anything like that? Okay.
Yeah.
So who was doing that?
Dad and mom.
Okay. So
Grandpa,
all right.
uncles.
You ever think about suicide?
No.
Like that? No. So you never thought about it, never tried it?
No.
Family history of suicide?
No.
Relatives? Okay. Have you ever been to a counselor or anything like that? Ever had a mental health diagnosis?
No.
So never been to counseling or
No.
seen a psychologist or anything like that?
No.
And I think I asked you if you're on any medications. You said no.
Yeah.
Have a family history of any mental health issues?
No.
Bipolar depression, nothing like that in the family? Okay. So, like in a day, what are you feeling? Like, what are your feelings? It sounds like you're drinking 3 or 4 times a week. So I guess just answer yes or no when I say this as most common emotions. So things you kind of feel on a daily basis. Does that make sense?
Yeah.
All right. So you feel depressed?
Sometimes.
Okay. Agitated?
Sometimes.
Okay. Like on a daily basis, you'd be?
Not on a daily basis. No.
Okay. How about depressed?
Not on a daily basis.
Okay. Agitated, anxious?
No.
Okay. Confused?
No.
Bored?
Not on a daily basis.
Okay. Sometimes. Fearful? Okay. Angry?
Not on a daily basis.
Okay. But sometimes?
Sometimes.
Ashamed?
Yeah, lately.
Okay. Hostile?
No.
Okay.
Well, sometimes. No, not on a daily
Okay.
basis.
Hopeless?
Just lately.
Okay, so lately you've been feeling
Yeah.
hopeless. So it sounds like lately hopeless and ashamed, and then not so much hostile, agitated, depressed.
Yeah.
Okay.
That's pretty accurate.
How would you describe your self-esteem from 1 to 10?
9.
A 9?
Yeah.
What does a 9 look like?
Confident, got a good job,
Okay.
created good life for myself except the drinking.
Yeah.
So,
Okay. So are you married or you got kids? or-
divorced, got one kid
Okay.
named Knuckles. His nickname's Knuckles.
Oh yeah. How old's he?
16,
How long you been divorced?
couple years.
Alcohol been anything to do with that?
Yeah. Had everything to do with
How are you getting along with that?
that. Pardon me?
Do you see your boy? Do you get along? Are you guys all good?
Not really. Kind of resent me.
They kind of resent you.
Yeah.
Yeah.
They're always fighting on me. They only call me when they need a check.
Yeah.
I'll take the blame on it. It's because of my drinking.
Yeah. Well, I'm glad that you're in here to sound like take some steps. Sounds like you're gonna have some time. How much time are you looking at?
5 to 7 years.
5 to 7 years. Is that like a good scenario? 5 to 7 years, or you
That's
maybe got
probably
paroled
the
after a
max.
couple years? That's a max.
Yeah.
All right.
That's what the lawyer's saying.
Okay. Are you all through that system and just waiting to sit your time at this point? Or?
Yeah.
Okay.
Yeah. I'm in prison.
Yeah.
And I accept that. Probably I deserve that.
Yeah.
Taking responsibility in my life. For the first time in my life, I'm also free. I'm not a victim to this, to drinking. I didn't realize, how much I was a victim to all this happening.
Yeah. Well, I don't think you're out of the woods yet if you drank yesterday, but you're, as far as taking this step to get into some treatment, then yeah. I don't know that you're out of the woods, but you can see the light, I hope. Yeah, for sure. You got anybody that's close to you right now, or?
Yeah,
You got people you're spending time with?
yeah, my girlfriend.
Alright. Does she have any concerns? Does she express any concerns about your drinking?
Yeah,
Okay.
oh yeah.
What's she think about it?
She knows I have a problem.
Okay. So basically she's just like,
She wants me to get help.
she wants you to get help.
Yeah.
Okay. Supportive or?
Oh yeah,
Okay.
well, supportive for me to get help.
Right, right.
She puts up with the drinking.
Okay.
She doesn't like it. She doesn't drink.
Okay. It sounds like probably a couple of years ago your wife was expressing concern. Your now ex-wife, your kid, they expressed concerns.
Oh yeah, big time.
Okay. Does that affect your relationship with them?
Yeah.
Still?
Yeah.
Okay. What's that look like?
It's just not good. Just not loving.
And you figure that's because of booze?
Yeah.
Well, I think next question is about your job performance, and it sounds like that's kind of why we're here. Is it sounds like that affected it in some way. You said there was a mechanical error, but
Yeah.
then there was also an issue of alcohol. So
Yeah. That's exactly right.
all right. So you ever missed work, been late for work, poor performance warnings, anything like that before this? Yeah. Okay. What'd that look like?
Just using before I went.
Using before work,
Yeah.
like drinking, using coke.
Drinking all night. Yeah, the night before, getting only an hour's sleep, and waking
Okay.
up drunk, and then having to do cocaine to function, to get the energy to get up, to get to work, and then
All right. Anybody in your family have a history of alcohol and drug abuse?
yeah, my dad was an alcoholic.
Okay.
That's it though.
Is he in recovery? Is he around?
He's passed away.
Okay. Did he ever try to get into recovery?
No,
or-
I never got
Okay.
sober. I think he had a problem like I do.
Okay. I'm going to give you a laundry list of symptoms. We kind of went over a little bit of them earlier. But have you ever experienced blackouts?
Yeah,
Shakes?
yeah,
Tremors?
yeah,
Excessive vomiting?
yeah.
Seeing things?
No,
Okay. Hearing things?
no,
Inability to sleep?
no, yeah.
Yeah. Paranoia?
No.
Paranoia is like
Yeah,
you
I
think
mean-
something's out to get you and
No.
there's really nothing there? No. Okay. Mental confusion?
No,
Okay. Obsessive thoughts?
no,
Abscess skin, which would be like an open sore or something on your skin?
No.
No. Okay, jaundice.
No.
Poor concentration.
No. Just when I'm drunk.
Okay. So yeah, I think a lot of these things, like blackouts, that would be when you're drunk.
Yeah,
So yeah, you'd
yeah.
consider it happening.
Yeah, that's what you meant, right? Just when I was
Yeah.
drunk.
Well,
Yeah, I've had blackouts because of
right.
being drunk.
Yeah.
Yeah.
Loss of time.
When I was drunk, yeah.
Okay. Any risk of HIV, unprotected sex, stuff like that?
No.
Okay. Hepatitis?
No.
But it sounds like you haven't been to a doctor. I think one of the things I'm gonna recommend, let's get you to the doctor as quick as we can.
Okay.
They'll probably do a med checkup like that when you have to go set your time, but
Okay.
let's maybe try to get you in before that to a doctor that you choose.
Okay.
So
Okay.
yeah. Have you ever been hospitalized for alcohol or drug problems?
No.
How much money do you think you spend on alcohol and drugs? Cocaine can't be cheap.
Yeah.
Unless you got somebody just giving it to you.
Yeah. Probably. $30-40 a day, 3 or 4 times a week. That's $120 a week. $450, $500 a month.
Okay.
And that's not if I go out. Now, if I go out with the pilots or the stewardesses, on the weekends, which I do, I'd probably spend that in a weekend.
Okay.
So I'd probably be blowing $1,000 a month.
Okay.
Probably more. That's when we get probably a couple $1,000 a month.
Probably a couple $1,000 a
Yeah.
month. Do you have any drug debts?
No.
Anybody?
No.
Financial problems?
No.
Okay.
Well, I'm not gonna have a job when I get out of prison, so
Yeah.
that's gonna be a big financial burden. But
Yeah.
I've accepted responsibility. Man,
So are you thinking you get your pilot's license back, or?
no, probably never fly again.
Okay. So it sounds like you've been drinking for a while. Did you ever use drug or alcohol while you're in school?
Yeah,
Did that affect your grades, stuff like that?
not really.
No.
When I was younger.
Okay. Have you ever been in treatment before?
No.
Ever been in 12-step AA, something like that?
No. I went to one meeting one time with my girlfriend now, and I couldn't get through it when they started whining about. I couldn't handle it.
Okay.
I got to get up and leave, and I went and drank.
Have you had just kind of give you a list of yes and no questions. Have you had a death of a close family member?
Yeah, I'm a dad.
Okay.
And my mom.
How long ago was that?
Dad 5 years ago. Mom 4 years ago.
Okay. Death of a close friend?
Yeah.
Okay. When was that? Tell me a little bit about that.
Buddy died in a drunk driving accident about 10 years ago.
You lose any of your friends in the plane crash?
Yeah. Yeah, my girlfriend.
How long ago was that? When you said that?
My old girlfriend.
About 6 months
Yeah.
ago?
It's the reason why I confessed, because they found alcohol bottles in the garbage of the airplane, and they asked me if in my opinion, was it the stewardess, which is my girlfriend, who was responsible for those, and I couldn't do it. She risked her life to save a kid. I just couldn't tell another lie, especially about that.
Yeah.
So,
Kind of an aha moment there.
yeah.
Yeah.
I didn't realize how sick I was, and I'm just sick, tired of being sick and tired.
Yeah. Have you ever experienced bullying or anything like that? Kind of
No.
No. Ever been involved in an abortion?
No,
Okay. Problems with your peers or friends?
no. Well, no.
No. No. Tell me what it'd look like if you did have peers
Well,
or a problem with your friends.
Just people didn't like my drinking,
Okay.
so.
issues with gender or sexual preference?
No.
Growing up, nothing like that. Okay. Hopeless feelings?
No.
Sound like you said earlier a little bit just recently here,
Yeah.
kind of when we were talking about the emotions that you feel regularly.
Yeah, because I know I'm going to prison, so.
Okay, so just about that time.
Yeah.
You said 5 to 7 years?
Yeah.
That'd be the long haul.
Yeah.
Sadness?
Yeah.
Frequent crying spells?
No.
Do you have problems concentrating?
No.
Any major changes in appearance lately?
No.
What about emotional abuse? What would that look like in your life?
Yelling, screaming.
Okay. Now, you said you'd seen that growing up?
Yeah.
Maybe uncles, mom and dad
Well,
fighting, anything
yeah.
besides that? Anything like later in life, friends, marriage, girlfriend, something like that? How old were you when that was happening at home?
Just little kid, 5, 10 years old.
Ever get reported or anything?
No.
Any history of physical abuse?
No.
Sexual abuse?
No.
Any history of sexual assault, rape, sexual harassment?
No.
Okay. Stealing?
No.
Okay. Any self-harm, cutting, picking
No.
at skin, burning?
No.
Are you interested in working on any of those issues? Kind of, it sounds like you had your friend die in the DUI and the plane crash, and your folks passing away. You're interested in seeing somebody working on that?
No, it'll all be taken. Oh, I'm cool with it. It's all behind me.
So behind you?
Yeah.
All right. Would you be open to it if we got done this assessment and the team says, yeah, we want him to see somebody as part of
Sure.
kicking the alcohol?
Yeah.
You'd be okay with that?
Yeah.
All right. So you'd be interested in it so far as if it'll help you kick the drinking,
Yeah.
Yeah.
Help me. It's gonna help me to
help you stay
keep the
clean.
drinking, yeah.
Any gambling issues?
No.
Nobody ever told you you had a gambling problem?
No.
Okay. What does the eating disorder look like to you?
I don't know. I never had one.
No issues with that?
Yeah.
Do you have an issue, any issues of sexually acting out, any trouble that way?
No.
Okay. We already went through a lot of that in that other screening. You feel like your sexual behavior is a problem? What does the word alcoholic mean to you?
Person who's out of control with their drinking. Person who drinks in excess all the time. To where they get drunk and just can't go without it.
What's the longest you quit since you're 15?
I made it 6 months once.
Okay. What was that like?
I was doing it for my wife and the kids. She divorced me anyway, so.
How long ago was that? Was the when you quit
5
for 6
years
months?
ago.
About 5 years ago. What made you start again? Let's go back 5 years, because you're sober for 6 months. That's pretty good clean time, man. So just going back to that time, what was it that you just because that had to be
Just
hard
had a
work.
fight with her, and was just angry, and just wanted to feel better.
Are you here voluntarily? Did you kind of come in here? It sounded like your girlfriend really wanted you to come in. Do you feel pressured to come in, or are you just kind of you're ready to
No,
get this?
I'm here, I'm ready to change. I have a problem.
You're here on time. I appreciate that. How's all the paperwork for you getting this set up?
It's fine.
This one. Have you heard of 12-step programs? You said that you went to one meeting, left, got drunk.
Yeah,
So is that something you're open to?
yeah,
Try that again.
yeah.
Were you brought up religious or spiritual or anything like that?
Not really.
Well, if you were, what would it look like to you?
Catholic, but we never went.
Okay.
Had pictures of the Last Supper on the wall.
So you're not attending right now?
No.
What role does like spirituality or like maybe in they call like a higher power, does that play a role in your life?
Not at this point. I'm open to what's gonna help, but
How many sisters and brothers you got?
one brother.
You get along with him?
Yeah.
He local? You get support?
No,
from him?
he's out of town.
Where are you living at right now?
My parents' farm.
Okay.
Well, it's my farm now because they died.
Yeah, so the family farm.
Yeah,
Who do you live with?
my girlfriend.
How long were you married?
13 years.
How long you been with your girlfriend?
Couple months.
Your girlfriend clean?
Yeah.
Okay. She have a history of use? Or?
Yeah. She's a heroin addict.
How long she been clean?
Month.
Who do you spend most of your time with?
Her.
Okay. What do you guys do if you're not drinking?
Nothing. Work on my little Cessna.
Okay.
She's always working, going to meetings. She goes to AA meetings.
Does she?
Yeah.
What have you been interested in the past, sort of hobbies, stuff like that?
Archery, hunting, fishing.
Okay. Are you spending your free time at the farm too, or are you at the bar? Or? You got a car?
Yeah.
That how you get around?
Yeah.
You still drive and stuff?
Yeah.
You got your license holder or anything? All right. Is there anything else that you can think of? How do you feel coming into this? Do you feel pretty strong?
Yeah, I do. I feel strong. I mean, I need help.
Okay.
I have a
What,
problem.
what do you think it's going to take for you to within this little short amount of time you got before you locked up, maybe get you in there sober? What do you think we need to do to get that done?
Just support. And, I mean, I had life in prison hanging over my head, and that didn't even stop me from drinking.
What does support look like for you?
Having people around me that care about me and want me to stay sober.
It sounds like maybe one of those persons might be your girlfriend.
Girlfriend.
Maybe if we could
Wife,
get your
kid,
brother over here for a little
brother.
bit, your son.
yeah,
Okay.
bosses, ex-bosses,
Okay. So maybe some work.
colleagues,
Okay.
or ex-colleagues.
Yeah. Sounds like your son's important to you.
Yeah.
Is that relationship kind of broken right now, or
Yeah.
is it? So it sounds like what can we do to help you?
Just what we're doing, just give me this treatment,
Okay.
educate me, support me.
All right. You willing to do work every day? You willing to
Yeah.
come here every day, attend group,
Yeah.
do your AA, and
You bet.
see a counselor?
Yeah.
Counselor for alcohol and a counselor for just talking about problems, things
Yeah.
like that.
Yeah.
Okay. What do you think your strengths are going into this? Like, what is in you that's going to pull you through this and be able to beat this?
Self-actualization, the realization that I'm so sick and that I'm sick and tired of being sick and tired, and I'm sick and tired of lying. I've been lying about my drinking and about who I am for a long time, and I want to get to know me. I want to get to know my son. I want to be sober.
Okay. Maybe heal some of those relationships, especially with your son.
Exactly.
Okay. Is there anything else that you can think of?
No,
All right. Well, no questions for me then.
I don't, man. I appreciate your time.
All right. Well, I appreciate you working with me.
You bet.